lot of good information. All right, so I will go ahead and I just have a brief introduction. So let me pull up my slides while we're letting everyone in. All right. You guys can see that? Okay, so this is so I'm Amy Duncan. I'm director of the Brink SBDC. We're at University of San Diego, and we are in partnership with Jacques Chirazi at the basement at UC San Diego. And we've been partnering to run information sessions on SBIR grants. And today we're focusing on NIH, and it's just an hour. We're going to hear, and I'll go over the agenda. Here it is. So I'm the host, a co-host with Jacques. We have two speakers. We have Saroj Regmi he's the program director at the National Cancer Institute Small Business Innovation Research Development Center. And he's going to talk about the process for NIH NCI SBIR grants. And then we have a funded founder, Kevin Strange, who is founder and CEO of Avidia Therapeutics, who's going to give us some of his history of what's worked for him and some tips for all you scientific founders out there. And then hopefully we'll have time for some Q&A. As we're going, you can put questions in the chat, and we can refer to those when we get to the Q&A section. And also, I invite you all to make sure your name is the way you want it to be presented. You go to your own video square and you click on the three dots. You can find the rename, and you can put your name, you can put the name of your company, you can describe your company, use the chat as if you were networking in person. Maybe you find your co-founder or partner or lab space or whatever it is. So real quickly, I'm going to just give you a brief overview of the Brink. We are a small business development center. We are housed at the University of San Diego. We are community facing. We serve students as well, but we serve the community like all of you that have joined us today. We provide free and confidential, because some of you might be in stealth mode, one-on-one advising and training events like this to help innovative founders, so founders in the life sciences and tech and clean tech. We help you access capital. And in this case, we're talking about SBIR funding so that you can build an investable company. But really what it all is about is to drive economic impact for a thriving community and ecosystem here in specifically San Diego and California. The Brink has a deep bench of 16 accomplished advisors whose expertise mirrors that of our founders, and we're bringing on more in the 2020. So you'll see folks with expertise in SBIR, med device, life science, therapeutics, and some tech and software. We host other SBIR events, so you can take out your phone and scan these QR codes, and Stephen we'll also put links in the chat. We have an SBIR Info and Advising session coming up on June 29th. It'll be hybrid in partnership with UC San Diego. And then following that, we will start our 4-week SBIR writing group series that's virtual. That's going to start in February and run 4 weeks. And then, of course, we have the free and confidential one-on-one advising that you can access nearly immediately at your convenience. Just scan that QR code to sign up. And Stephen Flynn will put all the links in the chat. Finally, just to hear about all the events we have going on, follow us on LinkedIn. That's where we post our events. We share events from our partners like UC San Diego. And that ends it for me. And I will turn it over to Jacques Chirazi.
Thank you, Amy. So welcome, everyone. We're excited to have you here for this first time that we're doing a webinar focused on NIH. So my name is Jacques Chirazi. I'm a director of student entrepreneurship here at UC San Diego. I work for the Office of Innovation and Commercialization. Same as Amy, we are one of the many centers on campus for entrepreneurship and innovation and supporting young entrepreneurs. So feel free to come to us. I will provide the links to the OIC website and the resources that we have as well. But we have one of many supporting elements on campus for young entrepreneurs and founders. And we support all kinds of companies. We obviously have a strong focus on campus, on life science, but we also support across the physical science as well in other areas. I will share a couple links in the chat about how to find more about our own events that we have through OIC and how to follow us on LinkedIn as well. And I want to recognize also this partnership that we're doing with University of San Diego is essential to help bring more of that knowledge to the wider audience and really allow people to take advantage of resources, especially in early stage ventures, to allow you to de-risk your technology as much as possible by taking advantage to using grants. And I will also reiterate what Amy was saying, that the Brink Center is an amazing place to really help you navigate through this, as well as we are here on campus for that. So thank you. With that, I'll start. We only have 1 hour, so we obviously encourage people to ask questions in the chat. We'll try to answer them either at the end or during, if it's something we could answer. But I'll start with the first speaker, so Saroj Regmi, who will dive into the specific of the NIH SBIR, and we'll get started with him. So thank you.
Thanks, Jacques. Try and share my screen. Can you all see my screen?
Yes.
Perfect. Great. So thank you very much for the invitation. My name is Saroj Regmi. I'm one of the program directors at the NCI SBIR Business Development Center, and today I'll focus on the NIH's SBIR program. So just for some of the people that may not be very familiar, SBIR STTRs are federally mandated programs. There are currently 11 federal agencies that have their own SBIR STTR programs. Department of Defense being the largest, Department of Health and Human Services being the second largest, and that's where NIH falls under. There are also other departments wherein your innovation might align with, so definitely reach out to those departments and definitely think of these as a really good non-dilutive source of funding in your journey towards entrepreneurship. So there are 27 institutes and centers at the NIH, NCI being the largest one, and this graph just highlights some of the other institutes wherein your innovation might align. And so, as I mentioned earlier, SBIR STTRs are congressionally mandated programs. And so they come in two different flavors. SBIR stands for Small Business Innovation Research. So this is a set-aside program for small businesses to engage with federal R&D with the goal of commercializing. So as the name suggests, these are awarded to small businesses. The goal is to do innovative research, SBIR. And so any federal agency that has an extramural budget of over $100 million is required to have an SBIR program. If the federal agency has an extramural budget of over $1 billion, they're required to have what is called a STTR program, and that's Small Business Technology Transfer. And this is to sort of help facilitate cooperative research and development between small businesses and US research institutions. So that could mean universities, that could also mean nonprofits. And the goal again is commercialization. So 3.2% of the total budget needs to go on SBIR and 0.45 on STTR. So that means for the NCI, the SBIR will be around $178 million. That was fiscal year 2023. For STTR, that's $25 million. And what that means is for the total of NCI last year, we awarded around $203 million of non-dilutive funding. The budget for NIH overall was $1.3 billion. So there's a lot of money that is available for your innovation. So at the NCI SBIR Development Center, we have a dedicated office of program directors that manage all aspects of SBIR, STTR. We're looking at scientific and technology, technical portfolio management. We're also here to provide you guidance on application as well as advice on resubmission. We also develop and manage different funding opportunities. We also have a lot of commercialization assistance initiatives, and we're also here to provide training and mentoring as well to our awardees. And if you think about our NCI portfolio, what I want to highlight here is that we are technology agnostic. And so we cover cancer prevention, cancer diagnosis, and cancer treatment. So it's not only therapeutics that we fund. At any point, we have around 450 active projects that are managed by 12 program directors. And we also use what we call contracts, and I'll get into that later. But 80% of our funding is generally around grants and 20% contracts. And if you see the spread of our portfolio, you will see that we're funding biologics, small molecules, imaging modalities, imaging agents, in vitro diagnostics, research tools, theranostics, digital health tools. So everything and anything to do with cancer. So we're pretty broad in terms of our coverage of cancer-specific innovation. I want to go over the eligibility criteria for SBIR SBIR here. So the award is always made to a small business. So the applicant has to be a small business concern. They have to be organized for-profit US business. So basically what that means is they have to be based in the US and all the work needs to be done in the US as well. Traditionally, you're supposed to have 500 or fewer employees, including affiliates. A lot of the times, given the nature of biotech, we have had applicants that have as few as 2 employees. So it really depends. And more than 50% ownership of the company has to be by US individuals. So more than 50% owned by individuals and independently operated. That is a requirement as well. But there's no stipulation in terms of the principal investigator on the grant. So foreigners are allowed to be PIs on the grants, provided that the small business concern that is receiving the award is owned and operated in the US and ownership is primarily US. So I really wanted to highlight that point here. The award is always made to the small business concern. And so that's one major differentiator between other NIH grants and SBIR grants. So you might wonder why go through this process of seeking SBIR SBIR funding. And I think the biggest advantage, obviously, is that this is not a loan. There's no repayment that is required. There's no impact on your stocks. It's completely non-dilutive funding. The IP rights are retained by small businesses. So NIH does not request IP for SBIR SBIR funded technology. And what's great is that it provides recognition, verification, and visibility. Every application that you submit has to go through a really rigorous peer review process at NIH. And so you really get really good feedback on your application. And in addition to funding, we also provide a lot of commercialization resources to help advance your project. So there's a lot more support than just giving you dollars that's non-dilutive. So it's a really attractive source of funding for you.
You said what?
At the NCI, this is a $200 million program. And so we've organized the program into different phases. So the first phase, which is sort of almost like a phase 0, is what we call a concept award. This is a high risk, high reward funding mechanism for projects that are that way. This is sort of our pipeline for innovation. Preliminary data is not required, and we provide up to $300,000 for a year's worth of work. After that, we have what we call a phase 1, not to be confused with phase of clinical trial. Obviously, a lot of our funding is for preclinical innovation. So this is to do some sort of proof of concept work. If you're in the therapeutic space, a lot of the times you will come in at phase 1 with some sort of in vitro data, and you're looking to either do more of the in vitro data or do some in vivo mouse studies. This is a $400,000 award for over a year's worth of work. After phase 1, you can apply for what is called a phase 2 to further your innovation. So you're doing more research and development, PK/PD kind of studies if you're in the therapeutics realm. So you are required to submit what is called a commercialization plan for a phase 2. And at the NCI, we provide $2.25 million for over 2 years. If you've already raised some friends and family funding and already have generated key data, you are welcome to apply directly to phase 2, and that is a direct to phase 2 mechanism. And if you want to combine your phase 1 and phase 2 in one application, that is essentially what a fast track is. And fast tracks afford you the combined budget of $2.65 million for around 3 years worth of work. You definitely want to have go, no-go decision at the end of phase 1. These tend to be extremely competitive, and you really need to have really well set milestones in order to consider applying for a fast track. And we also have an award, which I'm going to go into detail about later, called Phase 2B Bridge, which is sort of for IND enabling studies. This is a follow-on funding that requires matching funds from the investors, and we provide $4.5 million for over 2 to 3 years. And at the NCI, we currently don't have any phase 3 program. So if you go all the way from concept award to the bridge award, that's around $7 million in funding per project. And I really want to highlight that point here, is that it's per project. As a startup, you can have
Secretary of State.
As a startup, you can have multiple projects that you fund that you apply for at the NCI. So you could have a project at phase 2 and another one at phase 1 and things like that. So these are some of the funding opportunities that are available to you. I'm quickly going to gloss over it and focus on some of the key ones that might be of interest to you. But what I wanted to highlight is that every institute at the NIH will have its own different budget limit. There is this stipulation for a waiver cap depending on the priority areas of the institute within the NIH. The traditional budget for a phase 1 at NIH is $306,000, and for a phase 2 is 2.04. For any innovation that aligns with cancer, the phase 1 budget is $400,000 and a phase 2 budget is $2.25 million. Just wanted to highlight that. So you can think about going to the market with NCI in more than one ways. You can form your own company. You can partner with an existing small business. And you can also license the technology to a company and have sort of a partnering model. So there's different ways in which one could consider utilizing the SBIR STTR funding. I talked a little bit about grants earlier, and so I wanted to highlight the major differences between grants and contracts. First of all, these grants come in 2 different flavors. One is called an omnibus solicitation, and what that means is that it's investigator initiated. It's the way in which you have your idea and you submit your application to all of NIH. So if you have any idea that aligns with NIH, and you traditionally would submit through omnibus solicitation. There are 3 deadlines in a year, and traditionally January 5th, April 5th, and September 5th. And a lot of institutes, including NCI, will also have certain targeted solicitations that focus around certain NCI gap priority areas, and these can have variable receipt dates. Most of the things that we fund come through the omnibus solicitation. NCI is also a heavy user of contracts, and these change on a yearly basis. So every year we come up with different topics, 10 to 15 topics that we think are NCI priority areas that have a really strong potential for commercialization. There's a lot of NCI oversight on these contract topics. There's also a lot more reporting requirement and a lot of involvement of the program officer. So these tend to have a receipt date of 1 per year. And so these are contracts for you. And what's the major differentiator between grants and contracts is that grants have this really wide scope. Contracts are really defined by NIH. They're very focused. In terms of peer review, most of the grants are reviewed by a central office within the NIH called Center for Scientific Review. For contracts, they're reviewed within the NCI, Division of Extramural Affairs, and we target to have 50% business reviewers. For grants, you may speak with program officers at any point, and I actually encourage that. Please reach out to us prior to submitting an application. Reach out to us prior to submitting a resubmission. With contracts, you should contact the contracting officer, and you can't speak with a program officer. As I alluded to earlier, the grants have 3 deadlines a year for the omnibus solicitation. Contracts will only have 1 deadline per year. A lot of the time, that'll be around October, November. And there is set aside for a particular area for contracts, which is not the case for grants. And for basis of award for grants, most of the time, that's the score that you receive during peer review. For contracts, there is that scoring as well, but there's also a negotiation phase because we're thinking about final deliverables as well. And there's a lot more reporting requirements. So there's a kickoff presentation and there's a quarterly progress and final report for contracts. For grants, there's only a requirement for annual reports. So I think this is probably one of the most important slides that I want to leave you with today. It's the success rate. So what we've found internally, and this is from our data in 2021, is that if you look at the graph here, O1 are original submissions, A1s are resubmissions. And when you combine them together, you have the total. So our success rate stands around 10%. The original submissions have a success rate of around 7%, but resubmissions have a success rate of 20%. And so what that tells you is it's always a good idea to submit your application early, get that initial reviewer feedback, and be prepared to resubmit. You may not be successful the first time around, but during resubmission, your success rate is much higher. So this, I think, is really important information. So I already talked about omnibus solicitation. This is the mechanism for you to submit your application if you're interested in any department within the NIH. There are 4 different funding opportunities. 2 for SBIR, 2 for STTRs, 1 that is general, the other one that requires a clinical trial. And as I talked about earlier, you can submit a phase 1 fast track or a direct to phase 2 application for all of them. And we encourage that you talk to us prior to submitting an application. Definitely send, if you're thinking about NCI, send your specific aims page to nci.sbir@mail.nih.gov, and we're happy to set up a call and talk to you about your innovation prior to you submitting. We also have created a really novel funding opportunity called Small Business Transition Grant. This is a first of its kind funding opportunity at the NIH and NCI. This is a $2.65 million fast track award for early cancer entrepreneurs. So if you want to apply for a fast track, that's a $2.65 million award. If you only want to do a phase 1 STTR only option, that's available to you as well. And the goal here is to enable early career scientists for a career in entrepreneurship. So what it requires is that the PI is within 10 years of their terminal degree. They're either graduating PhD students or postdocs. They're required to have 2 mentors. One would be an academic mentor. That's most of the time your PhD supervisor or your postdoc supervisor. And they're also required to have a business mentor. So someone either from the University Tech Transfer Office or someone who has a lot of entrepreneurial experience. And so this traditionally is a once-a-year funding opportunity. The deadline is closed, but be on the lookout. We do have approval from leadership to reissue it, so it should come out. The other funding opportunity is Small Business Concept Award. I talked a little bit about this earlier. So the goal here is to support high-risk, high-reward technologies in pediatric as well as rare cancer. The goal is to de-risk really disruptive innovation. We're trying to find these really pie-in-the-sky ideas. This is a contract mechanism, not a grant. And what's really special here is that preliminary data is not required. So you have a really short application, which is around 15 pages. If you decide, you can submit a white paper that you can get input from prior to submitting a full application. And the review criteria is really special in that 50% of the scoring is based on innovation. So innovation is the most important component of this award. We are making awards rapidly, so within 6 months for this concept award, and we provide $300,000 per year. In terms of support, we leverage NIH's I-Core programs. We have an I-Core program specifically designed for Small Business Concept Award. We welcome participation once you are an awardee for the concept award. This can also be followed by another traditional phase 1, direct to phase 2 or fast track. So, I think what's really beautiful here is that preliminary data is not required. So we're looking for really innovative areas here. So the other opportunity is Bridge Award. So this provides $4.5 million over the period of 2 to 3 years. If you have a phase 2 award from any federal agency, whether it's NIH or whether it's NSF, whether it's DOE, whether it's DOD, you remain eligible as long as you're focused on cancer. And so what we require here is that awardees leverage this federal funding opportunity to attract private investments and partnerships with strategic partners. So in order to be eligible, you have to be able to raise at least 1-to-1 match from third-party investors, meaning that you have to be able to raise at least $4.5 million, mostly from dilutive sources, and you would be eligible to submit an application. And this has been highly successful for us. So through fiscal year 2021, we've made 46 awards in total. We've distributed $121 million, and companies have been able to leverage $4 for every dollar that we've provided them. This is data from 2017. And we've had 21 products that have launched, including new devices, new diagnostic approaches, and research tools for cancer patients from this award. So this is a really great funding opportunity for you to utilize federal dollars. So definitely take advantage. As I alluded to earlier, there are also various contract topics. These change on a yearly basis. I just wanted to give you an example of what kind of topics that we covered for fiscal year 2025, meaning that we are in the process of awarding some of these. So there was novel delivery systems for RNA-based cancer vaccines, synthetic microbes, HPV-related pre-cancer. So we're really trying to find these really narrow topics that we think have a really high scope for commercialization as we're thinking about creating these topics. And so these change on a yearly basis. So I really encourage you to go to our website, look at these contract topics any year and see if there's some sort of alignment. So just want to talk a little bit about some of the resources as you're thinking about applying for SBIR. The first thing that I will encourage you to think about if you are an academic institution or affiliated is what we call an entrepreneurship coursework. This This R25 grant mechanism will support development of programs that will equip the next generation of cancer researchers with entrepreneurial training. We will provide $300,000 per year for up to 5 years. So this can be up to $1.5 million. The goal here really is to make sure that the next generation of grad students and postdocs, as well as early career master's students, have an avenue to get entrepreneurial training, in the fields that's relevant to mission of the NCI. So this will be awarded to create courses and workshops with a broad scope: product development, commercialization, scientific communication, tech transfer, science policy, drug development, regulatory affairs, finance, marketing. So really a broad sort of umbrella of programs that might help train the next generation of academic entrepreneurs. NIH has also launched Entrepreneurship Bootcamp. So the program originated from NIH I-Corps, which was established by the NCI SBIR Development Center. So this is a new program that the NIH's Central Seed Office has launched. The goal is to offer really early stage, meaning pre-SBIR innovators, a really good foundational understanding of customer discovery and business model validation. So if you're an academic innovator, if you're really early and you want to get some sort of entrepreneurial training and you want some sort of customer discovery, this may be the right fit for you. This is a virtual bootcamp over 7 weeks that requires about 10 to 20 hours per week of effort from the team, not individually. And the selected team will interview around 30 customers and learn from this customer discovery process about their business model. So we cover hypothesis development, market segmentation, and this will end in a lessons learned presentation that you'll present to all the institutes at the NIH. So I've highlighted the application portal. There are multiple application deadlines in a year, so I encourage you to check out the next application deadline and consider applying. The other program is for first-time applicants. So this program is called STEP, SBIR STTR Training and Entrepreneurship Program. This has 3 stages. The first stage is customer discovery, interview, and business model development. So you'll be able to conduct market research. You'll be able to conduct customer discovery interviews and learn about your innovation. The second stage will walk you through the SBIR STTR application process, help you with submitting the application, and coach you through the entire process. And finally, there's post-submission support. So this will support post-submission activities, including reviewing summary statement, resubmission if you need to resubmit, and also just-in-time procedures if you are successful. So this is not a grant writer support. This is not NIH helping you in writing your application for you, but this is a really good way for US-based small businesses that have not received NIH SBIR STTR awards in the last 10 years and that are new to submitting a new SBIR STTR application. So this is a great program as well if this is your first foray into SBIR STTR. It can be daunting, so consider this as a really cool tool as you're thinking about SBIR. If you are an early career trainee that is thinking about working in a startup, this may be a really good opportunity for you. So this program is called Matchup. There are 3 different stages to this program. The first stage is that you email the Matchup program manager. I've highlighted the email. You will, to be screened for eligibility, we're looking for young trainees that are thinking about a career in entrepreneurship. You will have a screener call with the Matchup program manager. The second stage is the accepted participants are invited to online platform to identify potential partners. Matches will be introduced via the Matchup PM, and then together with the company and the individual that's been identified, you'll apply for the diversity supplement and you'll be paired to work in a startup. So if you're thinking about what it's like to work in a startup, this may be a really great opportunity for you as well. This is an NCI specific program. I wanted to share a little bit of the NCI SBIR economic impact study that we conducted, I think this was in 2018. What we found is that NCI SBIR has been really good for bringing innovation to market. So we've had $2.9 billion in new tax revenues. We've had $8.1 billion in labor income, and we've created 107,918 new jobs with an average salary of $75,385. So really good ROI. And we've also had a lot of regulatory approvals. We've had 14 devices and 11 drugs that have come out of NCI SBIR, 25 regulatory approvals, 20 first dosed in humans, 11 IND IDE applications, and 10 product launches. And what I want to leave you here with is that if you have any questions, if you are thinking about submitting an SBIR application, reach out to us. There's 12 program directors that are here to help you demystify the process for you and be your guide as you're thinking about entrepreneurship. Send us an email, shoot us an email, send us your specific aims page, or send us a one-pager of what you're thinking about. We're more than happy to do a one-on-one call if that makes sense for you and us. But definitely think of us as your resource before submitting an application. We have a website, a dedicated website, sbir.cancer.gov. We are on LinkedIn. We are on X. There's also an NCI SBIR Innovation Lab podcast, which you can sign up for if you're interested. What I also really would like to encourage you to do today is to sign up for our email updates. Go to our website. You can enter your email address at the bottom of the page, and you will get information about all these new funding opportunities, new programs that we create, new contract topics, and you'll really be informed of all the new opportunities that are available to you. With that, I thank you.
All right. Thank you, Saroj. That was a lot of information. And I know everybody in the chat wants your slides. And so we will get that to the attendees. So before we go to Q&A, we have a very special guest who is a funded founder, Kevin Strange. He is the CEO, founder of Revidia Therapeutics. And Kevin's going to give us a little tips and tell us his story of how he got SBIR funding. So I introduce Kevin. The stage is yours.
Thanks, Amy. Thanks for inviting me. Can everyone see my slides?
We can. Yep.
Okay,
Yes.
great. So as Amy said, my name is Kevin Strange. I'm the founder, president, and CEO of Revidia Therapeutics. And what I just want to do today, just in a couple of slides, is just briefly talk about my company, specifically where we're at, where we started, where we're at, just give you an idea of my background, mainly focus on the fact that I have extensive grant writing experience. So you need to take that into account when you start writing your own grants. And then also give you just a brief overview of my experience with and a brief thoughts on SBIR funding. Let's see. There we go. So Revidia is an IND-ready cardiac regenerative medicine company. We've been pioneering the development of first-in-class small molecule therapies, primarily for stimulating regeneration in the heart, but also in other tissues. I founded the company in 2013 to pursue a discovery that was made in an academic lab of a small molecule. We have 4 awarded patents. We have FDA orphan drug designation for our lead molecule. I've raised about $6 million in equity funding and about $4 million in non-dilutive funding. We've conducted extensive efficacy testing in 3 different animal species and multiple disease models of our molecule. We've had a successful FDA pre-IND meeting, and we've effectively completed all the farm toxins, CMC work that you need for an IND application. And at this stage, we're planning on filing an IND within the next 12 to 14 months. So the company is quite advanced from an early startup. My background, as I said, I'm the founder and president and CEO of the company, founded the company in 2013. But most of my professional life was spent as an academic bench scientist, most of that at Harvard Medical School and Vanderbilt School of Medicine. And then the last sort of full-time academic position was at a small independent research institution in Maine called the MDI Biological Laboratory, where this discovery was made. My expertise is in membrane physiology, not regenerative biology and medicine. That's another story altogether, but the company is focused on regenerative biology and medicine. I have extensive grant writing experience. I'm looking at pictures of people, and there's a lot of young folks. I don't like to date myself, but my experience is measured in decades, not years. So I've been doing this for a long time. I've been successful with grant proposal writings, but I can assure you my failures greatly outnumber my successes. And those successes, though, have allowed me, I've been asked to give many workshops and talks on grant writing and grantmanships, which I've done. And I've also mentored over a dozen junior faculty members with a focus and an emphasis on getting funded and staying funded and what happens when you don't. My SBIR experience, I've been awarded 2 direct to phase 2 SBIR grants. The first one was in August of 2017, and the other one was just this past September 19th, to be exact. I've also been awarded an SBIR-like grant or award from a National Heart, Lung, and Blood Institute program called the Catalyze program. That was awarded again in September, and the total funding raised from those sources is about $3.7 million. My SBIR success to failure ratio is about 30%. So that means 70% of all my applications failed. So again, something to keep in mind. It's not a slam dunk when you go down this road. I will tell you that Revidia has undergone 3 near-death experiences. The most recent one was last May. It was also by far the most painful. And this SBIR and Catalyze funding has absolutely been critical to reviving the company and keeping it moving forward. And as I mentioned, we're now on track to submit our first IND application within the next 12 to 14 months. So these are just some of my general thoughts on SBIR grant funding. I assume a lot of people on the call here have some grant writing experience. So what I'll tell you is an SBIR grant proposal is just another grant proposal. All the same salesmanship rules apply. Same thing you do in an R01 proposal. You've got to be able to sell what you are doing to the peer reviewers and get them to sort of across that finish line and hopefully give you a score that will get you in the funding range. Some of the pros of SBIR funding, which have already been measured or mentioned here, it's non-dilutive funding. You don't have to give up any kind of control or equity in your company. It also, very, very importantly, particularly if you're new to this entrepreneurship bench to bedside journey, it's going to really force you to think beyond bench science and hypotheses to what it really takes to try to commercialize a discovery made in your laboratory. They're 2 very, very different things. It also comes with many different resources. Again, those have been mentioned. You get access to expertise, mentoring, and networking. Any IP that you develop is your IP. It's not, or the company's IP. It's not going to be panned out to investors. And you get the peer review stamp of approval. Your work has been reviewed by people, scrutinized, and that's an important sales tactic when you're trying to raise investment. The cons of SBIRs are slow. And when I say slow, it's about 8 to 9 months from the time you submit the application to the very earliest you can get funding. And the reality is you're almost certainly not going to be funded the first time through. If you've got a competitive application, you can double or even triple that time frame. So I think my last SBIR was on this 3rd go-around by the time it was funded. So if you've got patent clocks ticking, you've got competitors knocking at the door, this is something you do need to consider. Also, I think that peer review on SBIRs can be more problematic than R01s. Peer review comes with its own issues. We're all human, we're all flawed, we all bring those flaws to peer review when we review grants. But the thing that I've seen, at least in the Heart, Lung, and Blood Institute, is that the majority of these grants, or the majority of the people on peer review panels, are academics. And I can't tell whether they've had any entrepreneur experience at all. In fact, I've seen comments that indicate to me that they don't. And this is something I've discussed with program officers, and they have indicated that that is indeed true. They have a hard time finding people who've really been on this journey and know what's involved. So that's just something you need to keep in mind when you're writing proposal. You are probably going to be talking to a lot of folks who don't necessarily know what it takes to do this, to take this journey. The other thing I've noticed, which again I've had confirmed by program officers, is often the scores don't match the comments. The 2 SBIRs that I've had, they've had some of the strongest summary comments I've ever seen in my career. And yet both cases, the scores are right on the borderline. So there is sometimes a disconnect between what the reviewers are saying and the score they give you. Just some of the points that I think are extremely important when you're thinking about this route. They're clearly extremely valuable for a variety of reasons, which I've detailed here and which you've just heard, but they're not a replacement for the necessary evil of VC funding. You're going to ultimately, particularly in the biomedical world, going to need to raise significant venture capital funding to get your idea, your discovery across the finish line. One of the things that you really need to make sure of is that you get to know your program officer
Awesome. Thank you, Kevin. Thank you for sharing your wealth of experience. A lot packed in there. So we have some time now for Q&A. I'll go ahead and just start with the ones in the chat. And then if you have a question, go ahead and raise your digital hand, and that'll put you in the queue at the top of our screen, and then I can call on you. So we do have one here. I'll just start with, well, I guess first of all is a general question is how can people search for grants? Because there's questions like I have my technology, just what's the best way? There's so much out there. How do you even begin to find a grant that's appropriate for your business? Saroj, I think maybe you can help direct us.
Yeah, absolutely. I think at least for the NIH overall, all of NIH, I think the easiest way is, first of all, I think the omnibus solicitation may be the way to go. That is sort of the investigator initiated. That's where you submit most of your applications. So that would be probably where you would select first. But what I always encourage people is to sort of write in one pager, see where you see fit, see which of the institute within NIH your application makes sense, and contact the program officer with that one pager, ideally a specific aims page if you can, and ask for a meeting. And I think they will be more than happy to tell you whether a phase 1 would be appropriate, whether a phase 2 would be appropriate, or whether there's another funding opportunity out there that might make more sense. A lot of it, you can also be proactive and, join our mailing list and learn about all of these new opportunities. But I think it's probably really helpful if you can talk to a program officer before you're submitting your application.
Great. And we have a couple questions that sort of are around sequencing. So do we start the company first? Do we get our patent first? And when do we apply for the grant?
Yeah, absolutely. Great points. A lot of the times, like I said, the SBIR, STTRs, they're always.
I called you 2 or 3 times to open the garage.
Sorry,
Mute, please.
Yeah, the SBIRs are awarded to small businesses. So a lot of the time, company formation is required to happen first. In order to be competitive, you want to have your IP figured out because you need to have that path towards commercialization. So that IP part becomes really important as well. So you at least you want to have some sort of a preliminary patent of sorts before submitting an application.
Patent first, and then of course you have to be, because it is a small business innovative research grant, you have to have your business established.
Absolutely.
Mm-hmm. And then I guess if you're at the university, you should solve that conflict of interest in licensing situation.
Absolutely. And there could also be, with the university there, if you apply using STTR, there is that additional flexibility in that, there could be a collaboration at the university and with a small business. So it really depends. There are a lot of different ways in which one can consider utilizing SBIR, STTRs being a university. If you would like to be a PI on an STTR grant and you are an academic, I think STTR probably makes most sense because, for STTR, there's no stipulation in terms of, PI's employment being at the startup. For SBIR, you have to be primarily employed by the startup. So for STTR, it's required that you spend at least 10% of your effort on the grant. So I think the STTR would make sense in that case.
And when you say, I've had this question before, when you say PI, this is not the PI of your lab, you can be the PI.
That's right. PI of the grant. Yep. Thank you for asking me that. Yep. PI of the grant.
Even if I'm doing STTR and I'm in the academic, even though I'm not the PI, I can be this PI.
Absolutely. Yep.
Yeah. This is how you give yourself a promotion. Okay. Okay, so we have another question from Chris Liu. Take spin-off startup from academia lab as an example. Does 50% ownership by individual mean the grant pays at least more than 50% of the business and the academia lab can pay less than 50%? If that's doesn't make sense, we can ask Chris to clarify.
Yeah, no, I think what I can clarify is that, so I think he's talking about STTRs. So there is that stipulation in terms of how much work can be performed at a startup and how much work can be performed at the university or an academic lab. And in case of an STTR, at least 40% of the work needs to be done by the small business, and at least 30% needs to be done at the academic lab. And there's flexibility in terms of the remaining 30% in terms of where the work is being carried out. I hope that answers this question.
Okay. How long can phase 1 last before you have to apply for phase 2?
Yeah, till you can generate that data. A lot of the times phase 1s are thought to be 6 months to 1 year's worth of work. There are times when, they may be slightly longer, but a lot of the times when you're submitting an application, you're thinking about 1 year's worth of work. And then your phase, and also applying for a phase 1 and phase 2 can, differ based on the data that you already have. So if you already have in vivo mouse data, you probably want to apply directly to a direct to phase 2. If you have in vitro data, you're probably looking at a phase 1. So, that can be a consideration too.
There's another question about the project pitch versus the full proposal. Is that always the sequence, or is that just specific to the NCI or specific institutes about a project pitch coming before the full proposal?
Yeah, so the project pitch idea, I think that's sort of the NSF's SBIR SATR model. At the end, NCI, we encourage you to submit a one-pager. You don't have to, but it just gives us sort of something to talk about so that we can give you more, specific advice. So we always like it if you at least submit a one-page specific aims page before talking to us, or you give us a one-pager so that we can, point you towards the right direction. There's not a stipulation for submitting a pitch for NIH.
Do you have a sample one pager?
Absolutely. It's available on our website. I'm happy to find that. NCI sample. We have a sample one pager. We also have sample applications that are available to you for some successful ones. So this may be helpful. So I'll share that in the chat for everyone. This is sort of some of the sample application. And we also have, if you Google how to write specific aims page, NCI cancer, NCI SBIR, I think aims page NCI, you should be able to find this really good page on what constitutes a good specific aims page.
All right, great. I see that in the chat. Well, that brings me to a very good question about, well, more than Google, can I just ask AI to do some work for me? What is going on with that using Chat GPT, Gemini, et cetera, to do the writing or help assist you in the writing?
I don't think NIH has a position officially on that, but given that all of the data that is being generated is yours, you probably don't want to put your data that you've generated on AI's platform as you're thinking about utilizing AI. So I leave that up to you. We don't have an official position internally. We don't use AI because this is all proprietary data that we deal with, but externally it depends on you. I don't know if we are there yet in terms of having a highly successful application that one can write utilizing AI, but I don't know enough about the field.
All right, so it sounds like it's no rules. It's up to but to be mindful of putting it out there in the public.
Yeah.
All right. Any other questions, you guys? We have 8 minutes. Questions for Saroj or Kevin? You can type it in the chat or come off mute. Well, I have a question. So when you read, first of all, what's the difference between a program director and a program officer?
It's the same actually, yeah. So I think it's just used interchangeably at different institutes.
Okay, and when you say reach out, is that like you said, you gave us the page, I go find you on the page, find your email, or the general mailbox that you gave us and just fire off a request?
Both, yeah, both works. We're at least at the NCI, we're really happy to talk to you before you submit an application. So, we're always talking to applicants all the time. There's 12 of us, so, we're happy to do that. Any
tips for founders who want to send an email on what they should prepare or present in their request?
Yeah, that as I said, that one-page specific aims page is really helpful. At least talk about what it is that you're thinking about, your innovation, what kind of preliminary data you have, and what kind of what it is that you're going to be proposing in your SBIR.
We do have a question. Can you apply to multiple agencies at once or similar technology applied to various medical fields?
As long as your aims are different, if you're if you have a platform technology that you think would be applicable for cancer as well as heart disease, you are welcome to do that. I would probably focus on one. If it's your first time submitting an application, I would probably try to get the foot in the door before firing off 5 different SBIR SATR applications. But if it's a platform technology, you can do that. But you will not be able to submit an application if you have the same aims to multiple institutes within NIH. That's not allowed. You're supposed to have at least less than 50% overlap in your aims when you're submitting an application and getting funded too.
How strong does the preliminary data need to be?
That's a really subjective question. It really depends. Depends on your innovation, where you are, whether you think about a phase 1 or phase 2, whether you think about concept award. In case of concept award, there's no requirement for preliminary data. So yeah, that really depends.
Yeah, that's what it was. The concept award, where it's really an innovative idea, not a crazy idea, but you've got an idea. Can you convince someone else? and get some, and you get what, 300,000 and you can
Yep.
get a little work done on it.
That's right. And it does, I mean, it's not, there has to be a scientific rationale. Obviously, there has to be some publication that supports your hypothesis and things like that. But I think, that's one mechanism wherein preliminary data is not required.
Does the company's IP need to be affiliated with university to get funded?
No, it doesn't.
Mhm.
If you're applying for SBIR, these are for small businesses based in the US, so no university affiliation required whatsoever.
Mhm. I have a question about, let's see, you mentioned the entrepreneur coursework and the steps. So this is like just like the entrepreneurial coursework, is that something that like me and Jacques could apply for
Absolutely.
and offer that to our, it's just for students, or can it be entrepreneurs in the community?
A lot of the times, no, actually, it has to be students, graduate students, postdocs, undergrads may be allowed, but it's generally focused towards graduate students and postdocs. And yeah, that's, and you are welcome to apply. It should serve multiple institutions, so it can't be a coursework just for one university. There's, if you read the notice, you'll get more detail, and happy to share that too later.
Okay. Does the fast track option have a lower success rate, or is it the opposite, given that it requires more detailed information than phase 1 or phase 2?
So fast track will require you to have enough data to, show reviewers that you're able to have that phase 1 done, and you have that milestone that you're able to meet, and then also do phase 2. So obviously you need strong rationale and strong data in order to apply for fast track. It is quite competitive given that it's a multi-year award, but it's hard to compare success rate between a fast track and a direct to phase 2 and a phase 2, just because you're comparing apples to oranges.
Yeah, we got a few more minutes if you want to type in a question. So I'm going to ask about the NCI step. I made a note here. That, remind me what that was. It was a lot.
Yeah, so STEP is for first-time applicants, some support for first-time applicants that are thinking about submitting an application who may not be familiar with the NIH grant process. So the first step of STEP is basically customer discovery. You will conduct customer discovery, have a business plan, and then the second part is, getting familiar with the NIH grant writing process. There's an third-party contractor that will provide these services. And so there's, I believe, 2 application deadlines a year. And so at the end of STEP, you will be ready to submit an SBIR application.
Okay. Yeah, I like that concept for the founders that we serve at the Brink as an option, because you don't have to be funded. And we have an accelerator. We have a separate accelerator called the Lean Essential Sprint. It sounds similar. So I like that that's available. We have another question that popped up. What are the critical factors to improve the success rate?
I think there are 5 review criteria, but a lot of the time I think it has to have a strong scientific rationale. And the second thing that I would encourage you to, and to Kevin's point, I think about your reviewers. I mean, the people that are going to be reviewing your applications and what they like to see. A lot of the times they will be academics, and I think they will like to see strong data. They will like to see, people with strong scientific background. And there's also a lot of grant writing, finessing with the grant writing that becomes important too. You need to have strong data, obviously. You need to have a strong team. So these are some of the factors as you're thinking about SBIR.
And you did show us some metrics, like your economic impact measurements. So for founders who do get funded, do they have obligation or some sort of commitment to provide the economic impact they're making back to the funder? Like if they've hired people or they're generating revenue?
They do not. I think we hired a third party to do that survey for us, and a lot of the companies were happy to do that for us, but we don't have any expectations. We're always happy to see our companies become successful, get into market. I mean, that's what we're hoping for, is really successful companies coming out of SBIR and enabling these really cool technologies. But there's no strict requirement in terms of anything beyond that.
All right, we've got 1 minute, you guys. Well, I think in the respect of time, I will close it up here and thank Saroj and Kevin for presenting and the wealth of information that you shared with everybody. Jacques, if there's any final parting words you'd like to leave everybody with? Nope, you're on mute.
Well, same, I want to thank our speakers for being here today. It was amazing, great content, and we had good attendance. And then we will offer similar webinars next academic year. So please stay tuned, but it was great. Thank you.
Yep, Stephen will be following up with an email. Look for email from Stephen Flynn or at the Brink with all of the links and the slides and the upcoming presentation. So thanks again to our speakers, and thanks to all of you for attending our session, and have a great rest of your day.
Thank you for the opportunity. Thank you. Bye.